You've probably heard that you should wait until at least 6 to 8 weeks after giving birth before getting back into exercise. But what if I told you, as a physiotherapist, those first 6 to 8 weeks are the most important time for you to start your postnatal recovery? This is because pregnancy-related diastasis recti abdominis heals most within the first 8 weeks after childbirth. That means rehab exercises are most beneficial during this period. After those first 8 weeks, the ability to reduce the gap requires more effort. And the benefits of starting early go beyond reducing your diastasis recti gap. Starting gentle exercises before the 6 to 8 week mark helps equip you with the strength and the muscle coordination you need for those new routines, such as late night feeds, carrying your little one around all day, and transferring them into and out of a cot. This in turn can lead to reduced lower back pain, better posture, decreased likelihood of complications such as incontinence and prolapse. Now, if you are still concerned about exercising too early, the guidelines from the American College of Obstetrics and Gynecology state, if you have had a healthy pregnancy and a normal vaginal delivery, you can safely start exercising just a few days postpartum as long as you feel up for it. But what they don't tell you is what exercises to start with. It's really important to start gently with the right exercises and movements, and also understand the signs to look for that indicate you should ease off or stop. So that's exactly what I'm going to walk you through in this video. Recovery in the first 6 weeks postpartum can be split into 4 phases. The first is reconnecting with your pelvic floor muscles and your deep core using a 360-degree breathing technique, and it's the focus for the first 2 weeks postpartum. The second phase is progressing the strength and coordination between your pelvic floor and your deep core, and starts around the 2nd week and continues until the 6 to 8 weeks postpartum. The third phase is improving mobility and stability in the spine and the pelvis, and can start from the 3rd week and also continue until the 6 to 8 weeks postpartum. The 4th phase is building strength in everyday functional movements such as lunges and squats, and can start from the 5th to 6th week postpartum. So first, let's start with phase 1, which includes the 360-degree breathing. This technique is the foundation of postpartum recovery and ensures that the abdominals and the trunk muscles work together as a unit. Regular practice in the first 2 weeks postpartum helps to reduce lower back pain, improve your posture, and decreases the likelihood of complications such as incontinence and prolapse. Here's how you do it. Make your way down onto the mat, lying down on your back with your knees bent at a 90-degree angle and your feet flat on the floor. Place your hands at the front and sides of your rib cage. Take a normal breath in through the nose. Feel the rib cage expand at the front, sides and back, keeping your shoulders relaxed. Exhale through your mouth, making a sound like you're fogging up a bathroom mirror. You will feel your belly button move towards your spine as you zipper up from pubic bone to rib cage. On the next inhale, feel a subtle rise in your tummy and the sit bones widen as the pelvic floor muscles relax. As you exhale, the pelvic floor muscles squeeze and lifts as you zipper up from the pubic bone to the rib cage. Go ahead and complete 10 breaths on your back and repeat this up to 3 times a day. As you become more confident with the breath and you can feel the connection, try 360-degree breathing in various positions, such as lying on your side, where you can focus on getting the rib expansion and the mobility into the upper back one side at a time. Just remember, you need to do both sides. On all fours is another great position when performing in front of a mirror for visual feedback on making sure you really get that zipper up sensation from the pubic bone all the way up to the rib cage. Resting your feet on a chair or the wall is a great way to get your breath into the back body. This can be really hard postpartum, as during pregnancy, the breath moves more to the neck and the chest, and this is because your diaphragm gets squashed up into the rib cage, making it a bit lazy. Sitting and standing are great functional positions where you will be holding a baby, so it's really nice to check in with your posture to ensure you're engaging your abdominals and pelvic floor in those early days and not just jamming into your back and pelvis. It is important when you perform 360-degree breathing that you don't experience any pain, pressure in the abdomen or vagina, or incontinence during this exercise. In addition to doing 360-degree breathing, there are other things that are going to help with your recovery, such as tweaking several common daily activities and movements. These simple yet effective modifications on how you do things throughout your day ensure optimal recovery postpartum. I've put together a free guide with all the details on what these movements are and how to avoid them. You'll find a link to that down in the description if you'd like to grab a copy. Now let's get back to exercises you can start in your second week postpartum that increase the difficulty of 360-degree breathing, and that's by adding light resistance using either a gym ball or yoga block. Here is how. The first position is lying on your side with your head supported by a pillow. Place the yogi block in front of you at the level of the rib cage. Inhale through the nose as the ribs expand at the front, back and sides. As you exhale, gently press downwards into the yogi block, feeling the gentle squeeze and lift through the pelvic floor muscles and a subtle lift of your side body away from the floor. Inhale as you release and continue this for 10 breaths. The second position is lying on your back with your knees bent using a gym ball. Inhale through the nose as the rib cage expands at the front, back and sides. Exhale out through the mouth as you gently press downwards into the gym ball. You should feel the pelvic floor muscles squeeze and lift as you zipper up from pubic bone to rib cage. Inhale and release. Continue this for 10 breaths. Again, you want to repeat this 3 times per day for 1 to 2 weeks. If you experience any pain, pressure, or incontinence, your body is telling you that it's not ready for this resistance and you need to go back to using no equipment. Once you can complete the 3 lots of 10 repetitions and you feel you could do another set comfortably, you're ready to start phase 2. Let's do it together. Start on the floor on all fours. Inhale through the nose and feel the sit bones widen, the pelvic floor muscles lengthen, and the lower abdomen relaxes. Exhale out through the mouth, making a sound, and you'll feel a gentle squeeze and lift through the pelvic floor as you draw your 2 hip bones together. Maintain that connection as you continue to breathe for 3, 2, 1. On the next inhale, relax the pelvic floor and release the lower abdominals. Take a couple of normal breaths just to release and let go. Let's try that sustained contraction again. So inhale into the front, back and sides of the rib cage, and on the exhale, focus on the squeeze and lift of the pelvic floor, drawing the 2 hip bones together as you continue to breathe normally for 3, 2, 1, and relax. Continue this for 10 reps and repeat 3 times a day. Slowly, you want to build up the sustained contractions to 10 seconds over the next month. You again can perform these in various positions such as lying on your back, lying on your side, sitting or standing. During phase 2, you can also start to work on fast on-off contractions of the pelvic floor muscles, which are responsible for stopping you leak urine when you laugh, cough, sneeze, or even bend to pick your baby up. Let's have a go in sitting. Lean forward with your elbows resting on your knees. Relax your inner thighs, your bottom muscles, and your shoulders. It's very important to make sure that the pelvic floor is relaxed completely before starting this exercise. Take some slow, controlled breaths, just relaxing and lengthening the pelvic floor. On the next exhale, I want you to squeeze and lift and then relax as fast as you can. Keep breathing. You're going to squeeze and lift, relax, squeeze and lift, relax, squeeze and lift, relax, squeeze and lift, relax, and then inhale, just relax, letting everything go. It's very important to always remember to relax between each contraction, as a tight pelvic floor is a weak one. Start with 5 fast on-off contractions and complete that 3 times per day. Slowly increase up to 10 fast on-off contractions 3 times per day by about the 6th week postpartum. Now, something many women start to experience around the 3rd to 5th week postpartum is they really start to stiffen up in their spine. This happens due to poor posture and stability in the spine and pelvis as a result of caring for your new baby. This is when you can start phase 3 by adding spinal mobility and stability exercises. Let's now go through 3 stretches that are great at loosening up the spine to relieve aches and pains. The first is pelvic tilts. These are done on your back with your knees bent and feet flat on the floor. From this position, inhale, rock the pelvis forward, and exhale, rock it backwards as your lower back melts into the floor. Inhale, rock the pelvis forward again, and continue for 10 reps, repeating 3 times per day. The second stretch is a lumbar spine rotation. So staying down on your back with your knees together, exhale as you float your knees to one side, inhale as you hold the position, and then exhale, float back to center. Make sure you alternate side to side, completing a total of 10 reps up to 3 times per day. The last stretch is book openings. Do these lying on your side with your bottom arm supporting your head. Then bend your knees so your heels are in line with your tailbone. Inhale as you float the top arm open and let your gaze follow your palm. Exhale, gently close the top arm by bringing it back to the start position. Again, you want to complete 10 reps on each side at least 3 times a day. After stretching, it's time to work on stability. 3 exercises in particular are great for this, starting with heel slides. To do a heel slide, start on your back with your knees bent and gently find a neutral position of the pelvis by rocking it forwards and backwards. You want to then feel those 2 extreme movements and stop in the middle. Rib cage is melting through the floor, shoulders are nice and relaxed, and the back of the head is nice and long. Inhale, prepare, and then exhale as you slide one leg out straight along the floor. Inhale at the bottom and then exhale, float it back to starting position. You want to make sure that you alternate from side to side, again completing 10 reps on each leg 3 times a day. The next exercise is bent knee openings on your back with your knees bent and hands forming a triangle on the lower belly. Start again by finding that neutral pelvic position by rocking your pelvis backwards and forwards and then stopping in the middle of those 2 extreme movements. Inhale as one knee opens out to the side, only going as far as you can, keeping the pelvis nice and stable. Exhale as you float the knee back to center, making that sound, using your abdominal muscles to float the leg back. Make sure you alternate from side to side, keeping the pelvis nice and stable. Single leg float is the next exercise and has the same starting position as bent knee openings, but this time on the exhale, you're going to lift one leg up to tabletop. This is where the knee is directly above the hip and the shin is parallel to the floor. Pause on the inhale, and then as you exhale, you gently lower the leg back down. Alternate from side to side until you have reached 10 reps on each side, slowly progressing up to 30 reps. Strengthening the glutes is also very important in providing stability in the spine and pelvis. When the glutes are weak, the pelvis can adopt a posterior pelvic tilt position as the spine tries to find some stability. This puts a lot of strain on the deep core and the pelvic floor muscles, slowing down their healing. 2 great exercises to strengthen the glute muscles are bridges and clams. Let's go through them now. To do the bridge, start on your back with knees bent. Gently rock your pelvis backwards and forwards and then stopping in the middle of those 2 extreme movements. Now you have found a neutral pelvis, you want to keep this position. As you exhale, press up through the heels as your bottom lifts off the ground. Inhale as you hold the position at the top, and then exhale, lower back down. You want to aim for 5 to 10 repetitions and repeat this up to 3 sets with about a 30-second to a minute rest between each set every second day. To do the clam, make your way down onto your side with your knees bent. Your head, shoulders, hips and heels should all be in a straight line. The side body should be slightly lifted away from the floor, so you could slide a piece of paper between you and the floor. Inhale as you prepare, and as you exhale, squeeze your heels together as the top leg rotates open. Inhale to lower back to the starting position. Do 10 reps on each side and complete 3 sets consecutively with about the 30-second to a minute rest between, and again every second day. After completing these exercises for 2 weeks, you'll start to feel like that third set of 10 reps is getting really easy and you could do another set of 10. This is when you're ready to progress onto the 4th phase, which involves functional strength training and can be anywhere from the 5th to 6th week postpartum. Let's go through 3 great functional movements, starting with squats. Start by standing in front of the wall, feet slightly wider than hips and turned out just to create a bit of space. Inhale as you fold at the hips, sending the sit bones back to tap the wall behind you. Exhale, press through the heels as you stand up nice and tall. You want to complete 3 lots of 10 reps every second day. If this is too easy, move deeper into your squat. If you're not feeling strong or confident, you can make this exercise easier by doing a sit to stand from the edge of a chair. Exhale to press up through your heels to stand tall, and inhale to lower back down. Hip hinge is another exercise that can be done using the wall. It will come in handy when you're getting the baby into and out of the cot or unloading the dishwasher. For this exercise, stand away from the wall and relax your pelvis and trunk on the wall. As you inhale, hinge forward at the hips as you keep your trunk straight, and then exhale back to standing up tall, resting on the wall. Repeat 3 lots of 10 reps every second day. The next functional movement is a static lunge. Use a chair for extra support. Take an inhale breath as you lower down, slightly hinging forward on the hips to get more glute work, and then exhale, press up through the heels as you come back up nice and tall. Complete 3 lots of 10 reps on each leg every second day. As this gets easier, take the support away. Remember, these exercises are a guide. It is always important to listen to your body's signals, and if you experience any pain, pressure, or incontinence during any of the exercises I've demonstrated, modify the movement or choose a completely different exercise altogether. If you're more than 6 weeks postpartum and haven't exercised until receiving medical clearance at 6 to 8 weeks, you may not even know where to start. Be sure to check out my postnatal core essential video. This video guides you through a core workout designed specifically for postpartum women. It's safe and focuses on building strength within your entire core system to stabilize your spine and prevent future injuries.